The Roma people, more commonly known as Gypsies, are a unique group in that they are identified solely by their customs and traditions. Their past has been filled with persecution and discrimination, though today, Romani Americans reside mostly in lower socioeconomic districts in large cities. They are superstitious and believe in aligning oneself with God, but they are not associated with one particular religious sector. The Gypsies possess an intense distrust for outsiders of the Roma culture, also known as Gaja. This can make it difficult for healthcare workers to find cooperation from the patient and her family, especially when insisting upon staying with the family in the hospital. The nurse must observe the formality of avoiding marine, or uncleanliness, that is associated with the lower half of the body because of bodily secretions. Examples of such are when a Roma woman refuses to expose herself and discuss reproductive issues. The nurse should expect a Roma patient to have anywhere from 6 to 15 or more family members in the room with her. In Roma culture, age and male gender are revered, as women are more marine, meaning that the head of the family is usually an older male. These beliefs also affect the selection of a healthcare provider for a Roma family, as they are more likely to believe and follow the advice of an older male doctor. Roma people rely more on superstition rather than physiologic prenatal care. Roma women seek care only from their mother-in-law, who is responsible for her state of health. The pregnant woman is not supposed to perform difficult tasks and must have her wishes fulfilled in order to prevent miscarriage. If a beautiful woman passes by and the pregnant woman is expecting a girl, the woman is asked to trip over the mother's legs so that her child will also be beautiful. Since Roma women are more marine than their husbands, husbands are not permitted to be within the same building as the laboring mother. Women do not have home births because this would pollute the home. The family will remain with the patient from admission to discharge, and during labor, they will continually untie knots as an act of ensuring that the baby's umbilical cord remains untangled. The family will also dispose of all items that the laboring mother has touched to avoid pollution, as she is considered unclean until her child is baptized. Cultural customs for the Roma mother during the postpartum period consist of pampering the new mother. During this period, she is prohibited from leaving the house, fetching water from the well, making bread, receiving guests, and tending to her husband's meals. The only people that are advised to visit the new Roma mom are married women who want to have a child. Certain family members are prohibited from seeing the baby and mother, such as the father-in-law, during the entire postpartum period, which consists of 6 weeks. They believe in the importance of breastfeeding, and if the new Roma mother cannot produce milk within 3 days, another woman who fits the criteria of being clean, hardworking, and a follower of Roma traditions is elected to feed the newborn. After the 6 weeks are finished, the mother is considered pure again and can resume life normally. Women in the Roma culture have grown accustomed to a double standard in which abuse, mistrust, and poor sexual concept run rampant. The laboring Roma woman may be reluctant to undergo vaginal exam due to abuse, and her family may turn a blind eye to this. The nurse may need to advocate for the patient's health as well as the neonate's health. If education is insufficient, nurses working with the Roma may need to consider calling a social worker to provide an environment that will nurture and protect new children. Caring for the Roma patient can be difficult and even inconvenient for the hospital. Their beliefs and customs can appear strange and unappealing to the Western nurse. However, it is important to remember to accommodate differences in culture while in the hospital setting. Some even suggest bending the rules regarding the number of visitors permitted in the hospital room at once and extending visiting hours. Adhering to patients' customs and traditions within reasonable limits can help the nurse and other healthcare professionals establish rapport and, if successful, can possibly even lead to a special relationship that disrupts Roma tradition. Trusting Gaja. Bye.